He's got an issue here, femoral acetabular impingement syndrome, but his the angle of his femur, the leg bone here, is angled a little differently than most people, which sets him up for that impingement syndrome that you have. Hello everyone, Dr. Dave Kulla here with Synergy Wellness, Chiropractic and Physical Therapy. Today we have a guy here that he's a dentist to be soon, in training, dentist in training, doctor in training. And we're going to talk about, he's got an issue here, femoral acetabular impingement syndrome. And why don't you tell him your theory on why you have it. He was a big hockey player, but his the angle of his femur, the leg bone here, is angled a little differently than most people, which sets him up for that impingement syndrome that you have. He had surgery, right?
Yes.
Had surgery on one side, on the right side, and it was pretty successful for the most part. You had it about 8 years ago?
Yeah, I'd say 8 or 9 years ago.
The only downside to the surgery, I guess, was that you felt like you're imbalanced ever since you had the surgery. Is that right?
So, I feel like anytime you open up the body, it's a lot of scar tissue that develops. So I think that's one main drawback, is it's always very tight.
Mm-hmm. Did you rehab it well and try to break up that scar tissue after the surgery?
Yeah, I was on a very extensive rehab protocol, physical therapy and all that.
Okay. So that why probably one of the reasons that helped it become successful. It's really also that the rehab afterwards.
Yeah.
A major surgery like that. Although I would say of all the surgeries, hip surgery is probably the best. The outcomes are pretty good, so we're going to get into a spot that's going to be tender. Is that tender in there?
Yeah, it's kind of tender.
So we're just loosening up his glutes a little bit. It's important that he keeps loose, especially because now he's sitting as a student in front of probably Zoom, in front of his computer all the time now, right?
Yeah.
Which isn't really great for him. If you have a stand-up desk, that would be good for you,
Sure.
Foam rolling, do you foam roll at all?
I do foam roll a lot.
Okay. Lacrosse ball in the glutes here?
That's one thing I should do more. But I
Do you have a lacrosse ball?
I have the one you gave me.
Okay, good. Yeah, I'm a big fan of the lacrosse ball. It gets into areas that you can't otherwise get into with a foam roller or any other, stretching any other way. So, in some cases of femoral acetabular impingement syndrome, you can adjust that hip. And we'll check his ankles today. We got a foot of snow out there today, so I commend you for coming in today. It's a blizzard out there. There we go. We're going to do a little ART. So I'm going to have you turn over on your side. Face the left. All right, you're going to swing that leg forward. Yep, and back. And forward. Yep. Good. 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 Sore in there?
Yeah, it's pretty painful.
All the way, good. Okay, relax. And the other side up. So this is active release technique. Alright. Same side, go ahead. Good. Let me know when you get tired. Okay. Now I want you to lay on your back. Everybody knows what this is. This just helps with vibration melt those muscle spasms, tense muscles away. And your hip flexors are tight. Oftentimes this creates imbalance. So most people are strong in their quads and weak in the hamstrings and the glutes. And that creates an imbalance, especially when you sit all day and these muscles are contracted all day. So that creates that imbalance again, called lower cross syndrome. You have a little bit of that, right? So abs are a little bit weak and hamstrings are a little bit weaker. And these are more dominant, these muscles in your hip flexors. And that could have to do with all the hockey that you played. You said you played a lot of hockey when you were younger?
Yeah, and working out, so it's a combination, I guess.
Powerlifting? So hockey and powerlifting certainly could do that also to the angle, because the angle of your femur goes back, right?
Yeah.
So if I were you to improve this, I would stop working out the thighs. You've got big thighs here, and start working out your hamstrings. Just cut this out, quads and thighs and hip flexors, no more squats, and isolate your hamstrings and your glutes. And that will make a big difference for your lower back and your hips and your flexibility. Okay? Hold on a second. Okay, lay on your stomach again. Okay, let's have your right side up. So yeah, just isolating hamstrings and glutes and just cutting out quads on your leg workouts for the next 9 months. Do you think you have a hamstring weakness too?
I think they're very strong.
Compared to your quads though?
I think because they're tight. Do you think like a tighter muscle would be stronger?
Not necessarily. Your hamstrings are tight is what you're saying.
Yes, like naturally.
Yeah. And relax here, good. What that usually does is it straightens your back. So when you have tight hamstrings, you have a hypolordosis or a flat back, which is what's going on with you. You compensate in other areas. Flip over on the other side. And bend, yeah, and straighten the bottom leg. That hip moved real easy, as you noticed. On the other side.
Really?
Oh yeah, you didn't hear it? It was loud. Did you guys hear that? It was loud. Take a deep breath in and blow out. Relax. Okay, and on your stomach. Good.
That's a little tender.
Yeah. So he's got these tender spots right here in the middle of his back. These tender spots kind of dip down, and what they're called anterior subluxations, where the vertebra is shifted forward in towards the chest cavity. And if I adjust this way with him face down, it's going to make him worse in some cases. So we only want to do that from about here down. Other than that, up here we want to be careful with that. So we're going to go right here. Go ahead, bend your knees for me. Take a deep breath in.
Like bend them up?
Yep. Good, and blow all the way out. And drop your legs. Good. And turn over on your back. Slide down a little bit for me. Good. Cross your arms in front of you. Tuck your chin, tuck your shoulders, deep breath in. And blow all the way out. Good. And again. Relax, good. Head back. So, a lot of dentists have a lot of neck and upper back issues just because of the, the kind of work they do. Hovered over people's mouths all day using their hands, and it's not an easy job. Dental assistants, we actually see a lot of dental assistants. Relax your head. So there's not really other than having a dental chair that goes all the way back, there's not really an ergonomic way to do it, is there?
Yeah, I mean loops help a little bit, but like I feel like there's always gonna be some kind of strain.
What's a loop?
The glasses with the magnifying lenses.
Okay, yeah. But your neck is still in a funny position all day long.
Yeah.
Same with the assistant. Lift your head gently and drop it back. So what we did to his hip, ART, is kind of hard to do to yourself. So it's impossible to do it for yourself, but you can do it on your neck for yourself. And I'll show you how, just a minute. Okay, go ahead, sit up and on this cushion here that your shoulder's on. So right here, facing that way. Yep. Okay, so what you're going to do is you're going to take these two fingers, tissue pull down and tilt your head down. Then you're going to bring your head and hold those fingers in place.
Wow.
Intense, right?
Very.
Let go. When you're ready, do it again.
So turn and then go.
Tissue, no. Watch, turn like that, do a tissue pull down. So tissue pull is reach up higher in the neck and pull down. Hold firm pressure, then bring your head, to the other side.
It's tough.
Yeah. Okay, now do it back here. Put your fingers over here. Ready? Here, I'll show you. Watch. Tissue pull. Start up in the middle to the higher part of the neck. Pull down. Tilt your head with it. Now go.
Yeah, it's just very, very tight.
You do this. Good. Keep tilting that head as far as you can. Good. You can also do a tissue pull here. Ready? Go. 1, 2, 3, go. That tissue pull should go at least an inch to an inch and a half. You want to get a good piece of muscle there. Okay. Now try it for yourself.
Okay, so tissue pull.
Yeah. And if you need more strength in the fingers, take this hand to anchor it. Like one hand's enough, that's fine. And all you need to do is 3 to 5 repetitions there, okay? Now, move your neck around, see how that feels. Big difference, huh?
Yeah, it feels less tight.
You haven't even done this side yet. Let's go ahead and do this side. Start up here, start in the back. Ready? 2 fingers, tissue pull. And then bring your head to the opposite side. Okay, again.
Where's the
Straighten your head,
spot?
straighten your head. Yep, now do a tissue pull.
Okay.
Start up here.
And pull.
Yeah. You want to tilt your head instead of turning it. You're turning your head. So you want it laterally bound, ear to shoulder. There you go. And again, tissue pull and laterally bend. More like that. And turning your head back. And again,